Hello and welcome to the Alternative Left Show. Today is the 24th of September 2018. Now today we are covering the UKIP Manifesto. Now by the way the mainstream press were going on, I was expecting to read My Struggle by Adolf Hitler, but upon reading it myself I found what I would consider a very centrist, slightly nationalistic, very liberal manifesto. If I was to place it politically, I'd put it in the centre-right maybe, but personally I saw nothing which I would consider particularly far-right. If anything, I thought it was in some cases more far-left than the Conservative Party. So this manifesto is going to be reviewed over a series of 3 to 4 episodes because it is very long. I mean, there are 30 parts in this manifesto. Today we'll be focused on the health part of the manifesto, which is parts 2 to 4. I hope to do more reviews of other manifestos. I know the Labour one will be due out after their party conference. But anyway, let's get into this. So how I'm going to do this, I will read out the whole section and you can come up to your own conclusions about what you think. At the end I'll maybe interject with a few thoughts of my own. So, number 2, NHS policy in England. UKIP believes in an NHS freer to the point of delivery. The NHS is in crisis, not just from a lack of adequate funding, but because of an inefficient use of funds, private finance initiative contract liabilities, and an ever-increasing demand from foreign nationals who should have no entitlement to use its services free of charge. The current purchaser-provider purchasing system should be replaced, wherever possible, by more centralised purchasing systems designed to capitalise on cost savings. The NHS is a national service and not an international health service. The NHS is open to widespread abuse by non-UK citizens. We will end health tourism by foreign nationals. An NHS health card will entitle British citizens to use the NHS, whilst foreign visitors, unless specifically provided for by reciprocal agreements, will be required to have private health insurance. EU open borders have created a major drain on resources by bringing in around 3.8 million additional people. Many of these people will have no history of contributing significant tax revenue to help pay for the NHS, but have the same entitlement as British citizens. When Britain leaves the EU, this entitlement must not be extended to any new arrivals from the EU, unless national reciprocal agreements are negotiated with individual nations. The PFI scandal, introduced by the Tories and expanded by Labour, is draining much-needed funds out of our NHS. PFI contracts financed £11.8 billion to build hospitals in England, but will cost £71 billion to pay back over 31 years. UKIP will terminate these contracts by an Act of Parliament where possible. American-style litigation is out of control, with an estimated £78 billion worth of claims in the system, with the potential to destroy the NHS. UKIP would adopt the no automatic lump sum compensation policy and only pay for criminal negligence, similar to the Australian system. Where applicable, support payments should be paid monthly. We will address the shortage of GPs, nurses and midwives by waiving tuition fees in exchange for a minimum 5-year period to be worked in the NHS. This would dramatically increase the number of training places for British doctors, nurses and paramedics. British nursing applicants are being rejected because it is cheaper to recruit already qualified foreign applicants, and in some cases thereby lowering acceptable standards. We will prioritise training our own NHS workers rather than relying on recruiting medical staff from abroad. UKIP will scrap hospital car parking charges wherever possible, as it is currently being done in Wales. These are a tax on patients and visitors. Now, so far so good. I think that's a very good NHS policy. I think it's very fair. I would like to know what they're going to replace the purchaser-provider purchasing system with, and I also would like to know how they would manage the immigrants who are already here, as this doesn't seem to have been addressed. And finally, the only other thing which I would like them to address, which isn't covered here, I would hope that the NHS workers who are already here are not going to be victim of some kind of reverse affirmative action for British NHS workers in regards to promotion, and I would hope that that would be still based on equality of opportunity. But barring them 3 points, so far so good. So I will go on to the next part of the health and social care policies. Now number 3 is social care and mental health in England. This is a very short section. There is an increasing proportion of older people in the population whose care issues are not being addressed. UKIP will increase social care funding by £2 billion per annum to pay for additional residential, nursing and home care services. An increasing number of young people are suffering from mental health issues, and this needs to be addressed. We will introduce practical policies to improve the delivery of mental health services and increase mental health funding by £500 million per annum. On this section, I think nobody could disagree with any of them statements, so I will move straight on to the next section. Welfare and disability policy in England. This is number 4. UKIP is committed to maintaining a strong and robust supportive safety net for those in genuine need, but which will not be a soft touch on welfare. UKIP will end unfair ATOS-style work capability assessments and replace it with a system using qualified medical practitioners. UKIP is committed to protecting the rights of disabled people, and we will support their inclusion in the workplace whenever that is possible. UKIP would scrap the bedroom tax, which adversely affects many people. UKIP will stop child benefit being paid for non-UK resident children of foreign citizens. UKIP would not pay benefits to foreign nationals resident in the UK until they have paid tax for 5 years. Now I'm assuming on the last point, the benefits to foreign nationals resident in the UK until they've paid tax for 5 years. I'm guessing that's probably going to include the NHS if I was to make an assumption. I think they really need to clarify this in the manifesto. Now for this section I was a little bit concerned. I didn't like the soft touch on welfare quote, as I think the poor people in this society have been through enough, and that does come across as rather unsympathetic. The ATOS part, that would be an improvement, but personally I think it should just be scrapped altogether, as 1, I think it's very costly to the taxpayer, and 2, I think that a note from your GP should be more than sufficient to prove whether or not you are fit for work. Now for the last part, I thought they were very fair and very reasonable, and I could get on board with all of them proposals. Anyway, that's the end of the first part. If you like this kind of content, please consider subscribing. Now once I've completed all these videos, I do intend to do a full summary and full review, and give a mark out of 5 on how likely I would be to vote UKIP based on their first interim manifesto. I do respect that this manifesto is currently only an interim one, so it's not the full final thing. And if anybody from UKIP would like to respond to the points I've raised in the video, I would be quite happy to hear and respond to that. And don't be frightened to offend me, because I'm not a fucking snowflake, despite being left-leaning. So I'll try and get part 2 out as quickly as possible. And thank you for watching, and I will see you later.